Tinea versicolor is a very common problem, and it usually happens on the truncal area of young adults. And it can be enormously hard to get rid of, and it can be enormously hard to keep it from coming back. But overall, it's not an overly concerning diagnosis except for how it looks. And it looks as these little splotchy areas of lighter or darker skin, kind of in little circles all over your trunk. Now, there's many other things that can look like that. And so if there's any question as to the diagnosis, you really need to see a dermatologist. But once you have the right diagnosis, there are a couple of different ways of treating it. There are oral medications that you can get from your doctor. I usually use those as a last resort because once you take something orally, it goes throughout your body and it's processed through your liver. And the more you do those sorts of things, the more potential damage you could have internally. Now, sometimes I do that, but usually it's after we've tried some topical therapy. Now, you can get some prescriptions from your local doctor, and those are ketoconazole prescriptions, and you can put that on. And you can get some other prescriptions from your local doctor as well that are topical lotions. But you can also try to do this over the counter. So there's a product out there called Nizoral, and that's 1% ketoconazole shampoo. And what you do is you put it on all the affected areas of your body when you're in the shower, and you let it sit for 5 minutes so it has a chance to work. Because if you put it on and rinse it off within 10 seconds, that's asking a whole lot of the medication to do any good. So you put it on, and you don't need to rub or scrub it in. And for Pete's sakes, don't use the washcloths, because then you're just transferring that yeast all over the rest of your body. So you put it on with your hands, let it sit for 5 minutes. Rinse it off, pat dry. There's also another over-the-counter shampoo called Selsun Blue, or really any of the shampoos that have selenium in them. And what you do is you put that on your body and you leave it for 5 minutes. So what I recommend for people, if they want to try the over-the-counter approach, the topical over-the-counter approach, is one day do the Nizoral, the other day do the Selsun Blue, and you rotate that back and forth, back and forth. Now, it will take between 3 and 6 months before you start to see those different colored areas fade, those little splotches fade. And once they're completely gone, what I recommend that you do is once a week do the Nizoral, and once a week do the Selsun Blue in place of your regular soaps, and that should help keep it from coming back. The mistake that a lot of people make is that they treat it, they get it all gone, and they think, hey, I'm good for the rest of their lives. But they're not. The same conditions that started that yeast infection of the skin prior to treatment are still going to be there after. They still have the same genetics, they still have the same body habits, they still have the same exercise and all those sorts of things. So if you don't do something to prevent it, it's just going to come right back. And then you have another 3 to 6 months of treatment before the splotches go away. So get the splotches completely gone, and then twice a week, use one of these shampoos in place of the soap, and it should not come back. Now, with all of these things, you have to make sure you have the right diagnosis. So you should see a dermatologist first. But after you have the right diagnosis and after it responds appropriately like that diagnosis should, if it returns later in life, chances are you have it. And you've got some tips now to not only treat it over the counter and in a safe manner, but also how to prevent it from coming back. All right, good luck. And remember, we're here to help you become comfortable in your skin. Let us know how we can be of service. Thank you so much for watching this video. If you found it valuable, please subscribe below so that you can get up-to-date content when it's released. And please share with your friends and family so that when they're going through similar things, they have the knowledge that they need.